Ladies and gentlemen, good morning. Today is the 10th of October, and our DiaBeat webinar deals with the subject strong body. Now that's interesting. Our speaker is a physiatrist, and I was curious to understand the difference between or to understand the specificity of the nomenclature of physiatrist as opposed to uh, orthopedist, as opposed to osteopath, as opposed to physiotherapist. They were all similar in my mind, and therefore I went into a little depth to understand it more precisely. And, ladies and gentlemen, a physiatrist, my ignorance, and I'm happy to have understood it, is a doctor, an MD. You become an MD and then you take a specialization in the subject of physiatry, which means that you are a medical doctor and you can prescribe medication in addition to your holistic philosophies of keeping the body healthy. Remember, our topic is strong body. Now, what then is the difference between an orthopedic specialist and a physiatrist? Well, the difference is similar, but the orthopedic is usually a surgeon. A quick question to ask is what then is the difference between a physiatrist and a psychologist? A psychologist deals with the mind and a physiatrist deals with the body. I can go on being confused about osteopath and so on and so forth, but I won't do that. I will simply run into our subject. Now, the physiatrist deals with medical related aspects of, well, the body's physiology in relation to stroke, cardiac ailments, rheumatoid arthritis, rehabilitation, sports injuries, in the complexity of medical as well as physiotherapy. But the question to ask then is, how is this connected with diabetes? And as our many seminars have told us, diabetes is an ailment that manifests itself or impacts or creates problems relating to circulation, the heart, neurology, stroke, the brain, and so on and so forth. And therefore, ladies and gentlemen, the best person to prescribe on this subject is our speaker today, Dr. Shadan. Now, Dr. Shadan is, of course, as I mentioned, an MBBS, an MD, with an MD thereafter in physiatry, specializes in rheumatology and rehabilitation, did her studies, all her studies in Egypt with her MD in 2023. That's her MD in physiatry, and prior to that, her MD in medicine in 2014, and earlier in 2009, her MBBS. She deals with the whole range of physical impairments, chronic pain, neurological conditions, mobility, and so on and so forth. Ladies and gentlemen, I present to you Dr. Shadan, who will be talking to us about diabetes, of course, and more importantly, or most importantly, about a strong body. Ladies and gentlemen, Dr. Shadan.
Good morning, Professor Candy. Thank you so much for this wonderful introduction. I'm really honored and pleased to be part of this important event. I extend my gratitude to Dr. Wilco for all his effort and all his support. And hopefully the presentation today will be as beneficial as my fellow colleagues did before. I'll start now by sharing the presentation. Okay. It's visible now?
Yes.
Okay, thank you so much. So our topic today is strong body, steady sugar. We're going to answer the scope mainly about 3 questions, which is the why, the what, and the how. Starting by the why, benefits of exercise in diabetes. Of course, if I asked anyone, is the exercise beneficial in diabetes? The answer would be yes. But do we all know the full scope of benefits that exercise offer for diabetic individuals? Let me start by saying that exercise in diabetes is a key for better management and better health. Our first benefit, which is of course the major benefit and the most commonly known one, is improved blood glucose control. Exercise directly lowers the blood sugar because the exercising muscles take up the sugar from the blood for fuel, which helps to lower the blood glucose levels. The second point is that exercise increases the insulin sensitivity in the cells of the body. The cells of the body respond to insulin differently in diabetic individuals. This is mainly in type 2 diabetes. Their main concern, their main issue with the cells is the increased sensitivity. It also helps in type 1, of course, by decreasing the dose needed of the insulin to give the same effect. So regular exercise makes our bodies more sensitive to insulin, allowing our cells to use the glucose more effectively, which is of course crucial for managing both types 1 and type 2 of the diabetes. And eventually our ultimate goal is to reducing the glycated hemoglobin A1C, which is the key indicator of long-term blood sugar control. This is for the first benefit. The second one, maybe not spoken about a lot, is the cardiovascular health, that high blood sugar damages the blood vessels and the nerves, which increases the risks for conditions like heart disease, heart failure, and unfortunately, stroke. So what does exercise do in such case? Exercises lowers the blood pressure. Blood pressure and diabetes go hand in hand. Most common diabetic individuals unfortunately also suffer from high blood pressure. So exercise helps to control the blood pressure, which is a major concern for the people in diabetes. It also improves the lipid profile. Regular physical activity can improve the triglyceride level, the cholesterol level, the bad fats in the body decreases with regular continuous exercise, which of course eventually will lead to contributing to a healthier heart. The third part is directly helping in the blood vessels. Exercise promotes healthy blood vessels by improving the endothelium, which is the lining cells of the blood vessels. It improves the function of the blood vessels directly and thus reducing the cardiovascular risk. The third benefit is reducing the weight. Of course, exercising leads to weight loss. Exercise helps to reduce body fat and increase the lean body mass, which means the skeletal part of the body, the muscles, which is beneficial in maintaining the healthy weight. While reducing weight is not the target, reducing weight is a way also to help in diabetes. How is that? By better blood sugar control, and eventually, hopefully, it will reduce the medication need. Weight loss can decrease the insulin resistance, as we said before, leading to a lower blood glucose level, improved A1C test results, and potentially reducing the amount of the medications required. And in very active individuals that take it seriously at the first early stages of type 2 diabetes, it can even lead to the diabetes remission. This is, of course, in type 2 diabetes where high body mass index or high body weight is one of the major risk factors in type 2 diabetes. So significant weight loss, we're talking about more than 10% of the full body weight, up to 20%. This is significant weight loss in early stages of type 2 diabetes may lead to the remission, where the blood sugar level returns to the normal range. And I have to just put focus, and this is in type 2. The remission, of course, will not take place in type 1. Our fourth benefit is the overall well-being of the diabetic individual. Exercise boosts the energy levels. Regular physical activity can combat fatigue. Fatigue is a very common symptom in diabetes, leading to increased vitality of the patient. It improves sleep. Exercise can help regulate the sleep patterns, leading to better quality of sleep, which is, of course, also important in the overall health and the blood sugar control. And the third part is that exercise reduces stress. And as we know that stress increases the glucocorticoids, the steroid body production, and increasing in that hormone leads to increasing the blood sugar consequently. So reducing the stress by practicing regular physical activity or exercise is a great way to relieve the stress, and thus really helps in regulating the blood sugar level. So these are the main 4 benefits of exercising in diabetes, but they're not the only benefits. Let me share another part, not commonly talking about, that exercise is very helpful in protecting ourselves against common musculoskeletal complications in diabetes. So now I'm going to share with you some of the most common musculoskeletal complications that has a higher prevalence in diabetic individuals and can be prevented somehow by regular exercising. We will share some of the features and some of the symptoms we can assess together if someone is starting to complain of such symptoms or know someone who has it. Our first one is called the stiff hand syndrome, medically known as the diabetic chiroarthropathy. You can test it by putting the hand like that in the prayer position. Normally, our fingers should fully touch each other. If you find your fingers away from each other like that, like the picture, this means that unfortunately this has started the stiff hand syndrome. It is decrease in the joint mobility of the hands, appearing as skin thickening. So this is the first one, the stiff hand syndrome. We assess it by putting the hands in this prayer position, and normally the fingers should completely get in contact with each other. The second one is the adhesive capsulitis, commonly known as the frozen shoulder. This is also a very common presentation in diabetic individuals, and it has a very bad impact on daily activities. And if diagnosed early, if the patient notices it happening in its early stages, is very well manageable by physiotherapy, by some certain types of medications. It can help a lot if diagnosed in its early stages. So the patient starts complaining, that especially ladies, that she can't comb her hair, she can't grab something from a higher shelf. Even sleeping on the affected shoulder might be a bit painful. It is presented by stiffness and pain in the shoulder, and it is unfortunately also of a higher prevalence in diabetic patients. It can be assessed, like the picture seen here with this device. It is called the goniometer. It measures the angle by which the joint moves. Normal angles in all ranges. This is done by the physician. How do I assess myself at home? I have to compare it with the other side. Hopefully the other side will be a normally functioning side, by trying to put the hands behind the head and putting the hands behind the back and across the body. If you notice any discrepancy between the both shoulders, this means that you might be starting to complain of the frozen shoulder, and it has to be addressed in its early stages before it becomes irreversible. It is very common in diabetes, and it highly affects the activities of daily living. Even up to the point of wearing the shirt, the patient will complain that he cannot put on his shirt on his own. Our next complication is called the trigger finger or the shooting finger. It commonly affects the ring finger and the middle finger. These are the most common. It can affect any finger, but these are the most common ones. It is due to an inflammation of the tendons of the fingers. It passes by 3 stages, and of course, if we can catch it in the early stage, that would be better for therapy and helping it to avoid progression. It starts by pain at the base of the finger and tenderness if you press at the base of your finger, it is painful. Some pain during movement. So this is the early stage, the first stage with the inflammation of the tendons. And then the second stage, it goes into the locking or the shooting phase that gives it its name, that when you close your hand in a fist and then open it, you find all your fingers opening and one locked in this position. You have to return it manually and it does a click like that. This is the shooting or trigger finger. The third stage, if not treated at this stage, it will be locked in this position and even passively it will not return. And unfortunately, it might need the surgical intervention if it goes into this progressed stage. So addressing this situation early, of course, will help a lot in the management and avoiding of this complication. Our fourth musculoskeletal complication is called the heel, medically known as the plantar fasciitis. It is the heel pain after rest. This is also very common. What do we complain from? What is the main feature of this situation, of this complication? That the individual complains that when waking up in the morning, the first step after waking up, when putting the foot on the floor, it feels like walking on glass. It feels like pins. It's very painful. And after a little while, after moving or trying to walk, and as the day goes, the pain gets better. Then if they sit down to rest or to work for long times and then start to stand up again, then the feeling returns again. What is the cause of this? It is the inflammation of the covering layer of the sole of the foot. It is also very common in diabetes. As we said, it is a sharp or stabbing pain in the heel, typically worst first thing in the morning after periods of inactivity and can feel like walking on glass. This situation is potentially self-limiting. It can take from 6 months to a year, but of course, if addressed early, it will be better. It is very annoying, very painful, and very limiting of the activities. Getting to a more serious complication, that is the muscle atrophy and weakness, medically known as the sarcopenia. It is the progressive loss of skeletal muscle and function. It occurs both in type 1 and type 2 diabetes, can result from the nerve damage and the muscle damage. And the symptoms include weakness, reduced muscle mass, and limited joint flexibility. What you will notice in this muscle atrophy or the sarcopenia case, you will find guttering in the hand and in the feet. This is the most visible thing that especially ladies notice, that there is a change in the shape of their hands. The tendons are highly visible, the hand got thinner, and the feet also. And also it can be also visible in the bulk muscles like the upper arm muscle and the upper thigh muscle, where it loses its volume, it loses its mass. This is a very common also musculoskeletal complication. Our last one we're talking about today, and unfortunately one of the most serious ones, is the osteoporosis, which is the weak bone disease. Diabetes increases the risk of osteoporosis and fractures by deteriorating the bone quality. The bone itself, as you see in the picture, the normal bone, the cells are close together and tight. It makes the bone strong. In diabetes, the matrix of the bone itself becomes hollowed. The bone becomes soft, becomes weak. It can be fractured more easily. It can be bent. It leads to deformity and unfortunate fractures, mainly in the back, in the hip, and also a common fracture in the wrist. So this is a quick review of the most common musculoskeletal diseases or complications that happen in diabetes. How to prevent musculoskeletal complications in diabetes? Of course, the most important, our cornerstone, is controlling the blood glucose level. There is no debate in that. The first step is controlling the blood glucose level. The second wheel is the healthy nutrition. The third one is self-monitoring and early diagnosis. As we mentioned, all the symptoms, you have to always self-monitor. And if you suspect any of these complications, you should seek medical advice. Early diagnosis is very crucial. One wheel is missing, and of course that is regular stretching and resistance exercises. Regular stretching of the tendons of the hands, regular stretching of the range of motion exercises of the shoulder, weightlifting, simple resistance exercise, light weights. It doesn't have to be very heavy weights. Resistance exercises using light weights and bands can also protect against the muscle atrophy and the osteoporosis. Even body weight exercises, the exercises that you do with the weight of your own body, like the squats, like the lunges, like the jumping jacks, any body weight exercises or resistance using light weights and bands. And also continuing with the stretching exercises here, this is for the calf muscle, and this helps a lot in preventing and curing also in the plantar fasciitis or the heel pain after rest, as we mentioned earlier. So this is for the why. Why do we have to exercise? We said the benefits, and we said the complications that we can avoid by regular exercises. We can lessen to a higher extent. So what kind of exercise can I practice if I have diabetes? Actually, the exercises are grouped in 4 main groups. We have to be aware that there are 4 groups of exercises in order to know which type of exercise that I can practice. The first group is called the aerobic exercises. Aerobic exercises include walking, cycling, and swimming. They are exercises that involve multiple muscles of the body, and it is mostly low intensity exercise. They improve the cardiovascular health and improve the insulin sensitivity. The second group of exercise is the resistance training. Resistance, as mentioned, are either with weights or bands. The resistance training enhances the muscle mass, leads to increase in the muscle mass and increase in the muscle strength. Our fourth group is the flexibility exercises, like the stretching and the yoga. As we mentioned, stretching is very important in diabetes because multiple joint stiffness and multiple deformities is expected complication if not practiced regular stretching. It reduces stiffness and improves flexibility and in the diabetic individuals. Our final group of exercises are the balance exercises, like the Tai Chi. They help prevent falls and improve the stability for safer daily activities. So, what is the best exercise in diabetes? What group of exercise is the best in diabetes? Actually, the best exercise in diabetes is the mix of all these groups of exercise. It is a mix of aerobic activities like brisk walking, swimming, and cycling. It must also include muscle strengthening activities such as weight training and body weight exercises, as we said, like squats and push-ups. In addition, of course, to flexibility and balance exercises. So there is no single type of exercise that is recommended in diabetes. It's better to have a mix of all to get the benefits of all. But we have certain guidelines that we have to follow, of course, in case of diabetic individuals. So what we have to say that regular physical exercise is the key to help manage the blood sugar. As we agreed, it should be regular. It shouldn't be like I practiced exercise today and then next week I'll do once more. It should be a regular physical activity. We don't have to spend hours in the gym to get the benefit. We have a minimum amount that we mentioned now. We can start by a clear goal, like taking 10 minutes walk after dinner. So if you haven't practiced any exercise recently, start by small goals. Don't put yourself in a big load. Now, today I'll practice for 1 hour. I'll do the weights. I'll do so and so. Don't start it like that because it will not be beneficial and you will not be committed to it. You cannot continue doing that for a long time. So starting with a clear goal, like a 10-minute walk after dinner, which is simple and easy and doable, until we reach our ultimate goal. So our ultimate goal is 150 minutes of light to moderate aerobic activities weekly. That is 150 divided over 5 days, 30 minutes over 5 days, with the inclusion of 2 to 3 sessions of strength exercise like resistance, and also incorporating the balance and flexibility in these exercises. The point is to avoid going more than 2 days without exercise to maintain the blood glucose balance and health benefits. Skipping days without exercise will not give you the full benefit of exercise. So you practice for 1 day and then rest for 2-3 days and practice again. You will not get all the benefits that we mentioned. So the key point is to have it as a regular physical activity to get all the benefits. Before we start exercise, so we never practiced exercises before, it's the first time we're going to start. I'm a diabetic individual, especially in type 1 diabetes. It is crucial to check the blood sugar at least in the first few times to have an idea of how your body will work in this exercise. We have to check the blood sugar before exercising to ensure that it is in the safe range. The second point is to consult the healthcare provider. discuss exercise plans with your doctor, especially if you have complications, as some complications that might limit some exercises, some types of exercises that involve strenuous activity or weight-bearing exercises. We have precautions in practicing these kinds of exercise. And we'll talk about that later. So this is a sample weekly schedule. It includes all the points that I mentioned earlier. For example, it's not, of course, mandatory, so it's giving you an idea. Say we start on Monday, we start brisk walking. As we said, if your first time to walk, you didn't do it before, you don't have to obligate yourself to 30 minutes. We can start by 10 minutes. 10 minutes is your first goal. But this, let's say this is the ultimate target that we aim to reach by time. So Monday, minimum brisk walking for 30 minutes. Then Tuesday, we start our strength training, maybe some squats, some lunges, some push-ups, resistance bands exercising, targeting the major muscle groups. On Wednesday, again, we'll go to the aerobic exercises with swimming or water aerobics for 30 minutes. Thursday, you can rest. So now we went 2 days with exercise, 3 days with exercise, then you can take 1 day rest or do some flexibility training like yoga, which is very nice, very good effect in diabetic individuals. On Friday, we return again to the aerobic exercises. You can do cycling or dancing for 30 minutes. Saturday, return again to the strength training. As we said, if we can incorporate twice weekly of strength and resisting exercises. So this suggestion of focusing on the core and the upper body. Sunday is a day off. Maybe you can take it as a rest, or you can do also brisk walk or any other activity that you enjoy, aiming to reach the 30 or 40 minutes that we mentioned, with the target of full 150 minutes per week. So we have to know what are the red flags that we must focus on to stop the exercise. Be prepared to stop. So now you're doing your exercise. When is the time, the correct time to stop exercising? Say you didn't complete the 30 minutes, but if you stop, if the low blood sugar, if your blood sugar gets low, how would you know that your blood sugar gets low? If you feel shaky, if you feel weak, confused, dizzy, lightheaded, sweaty, anxious, or maybe having a headache. If you measure your blood sugar, especially in type 1, they measure the blood sugar a lot. If your blood sugar goes below the level of 70, then you must stop immediately exercising. On the other side, if your blood sugar goes too high, most commonly the blood sugar goes low with exercise, but sometimes with resistance exercises, the body produces ketones and this increases the blood sugar. If your blood sugar reaches over 250, 300, this can elevate the blood glucose level and increase the ketone production as a vicious cycle, which is, of course, dangerous. So if your blood sugar reaches a higher level of 250 or 300, you must stop immediately. If you feel any physical discomfort, like chest pressure, like chest pain, like nausea, or any loss of coordination or balance, stop immediately. If you have any kind of illness, if you have the flu, if you have cough, if you have ear disease, if you have gastritis, it's better not to exercise if you feel sick. This will put extra stress and pressure on your body and will elevate the blood glucose level or decrease it according to the exercise you're practicing. So if you're ill, better to skip that day. That will not make a big difference. But safety comes first. You have to focus of when to stop. Sharing now some important tips while exercising. You should, of course, always stay hydrated. Drink plenty of water before, during, and after exercise. While exercising, full flask of water beside you. Before, in breaks in the middle, during, and after exercises, always stay hydrated. This is a very important tip. You should always protect your feet. Feet are very crucial in the diabetic individuals, as the affection of the sensation, the probability of getting injuries. So we have to check the feet for redness, cuts, and blisters after exercise, because the sensation, as we know, might be affected, so we might not feel it. You have to visually check it after each exercise. And of course, you have to wear comfortable and fully covering sport-specific shoes. And you should carry some supplies. As we said, hypoglycemia is a very common thing that happens during exercise. So you have to always carry a carbohydrate source like glucose tablets, fruit juice or candy to treat the low blood sugar. It is sometimes life-saving. It's very important. If you're going to exercise, you should always have your supplies with you. This is a very important piece of advice. You should listen to your body. If you feel anything, any symptom, any feeling that is not normal, that is beyond your toleration, do not press yourself beyond your line. You have to take rests when necessary and be mindful of how you're feeling. And some patients also should take extra care, exercise with care. When do you exercise with care? And I want to just clarify this point. I'm not saying to stop the exercise, just put in extra care if you have one of these complications. And of course, it's better to consult your doctor. Some exercises, all exercises will give you some kind of benefit, but some exercises are better avoided if you have one of these complications. The first one is the retinopathy. Avoid high intensity training and resistance exercise. This is an eye disease affecting the retina, and it happens in diabetic individuals. If you are diagnosed by retinopathy, you will know that. So if you have this complication, high intensity training should be completely avoided. You should not carry weights that are heavy weights. Do not do resistance exercise. Do not do strenuous activities. This should be completely avoided. The second complication is neuropathy, because nerve damage affects the foot safety and affects the balance. So you have to take extra care. Like if you're running, you should, or walking, you should walk on a walk-friendly lane, not ups and downs, not rocks, because this will increase the possibility of falling, and we don't want that to happen. The third one is the joint and muscle disease. As we mentioned before, it affects, of course, the joints and muscles. If you have any muscle stiffness, any joint stiffness or joint pain, maybe associated with some osteoarthritis, some high impact activities should be practiced also with care. And finally, for the cardiovascular disease diagnosed patients, if you know that you are a cardiovascular disease, you have an issue with your heart, pre-exercise assessment is advised before practicing, maybe doing some treadmill and assessing for the cardiac situation before determining what kind of exercise would be suitable for you. These are not absolute contraindications of exercise. These are relative contraindications that does not stop you from exercising, but you should exercise with care to avoid further complications in these situations. So our most important advice is making it sustainable, be consistent. As we said, to get all the benefits of exercise, the exercise should be at regular intervals. Don't pass more than 2 days without exercise. We have to do it at 150 minutes per week, 30 minutes, 5 days a week to get the full benefit. Of course, if you can't do it every week like that, do as much as you can. But being consistent is the key, making it sustainable. So now I'll give you some advices. Maybe it can help in helping you in making it more sustainable by choosing enjoyable activities. Like if you enjoy some certain kinds of exercise, if you enjoy swimming, if you enjoy walking, if you enjoy going to the gym, choose enjoyable exercises. If you like to practice indoors, if you like to practice outdoors, make it easier on yourself, make it easier to sustain. Choose what is enjoyable for you. What do you enjoy to do? And put that mainly in your exercise schedule. The second advice is exercising in groups. Maybe a family member, a friend, a colleague, a fellow patient, any group that is in need of exercise. Maybe you can motivate each other. Partnering provides motivation, accountability, and enhances consistency in workouts. If one is feeling lazy that day, the other one will encourage you, and so on. Exercising in groups is very motivational and helps you to be more consistent. The third advice is the progress tracking. Most of us now have the smart watches that measures how many steps did I walk today, how many calories did I burn today, how long, what's the distance that I've walked today. All this, and it gives you like a weekly progress report. If you don't use this kind of watches, a simple diary would be very good. If you visualize your achievements, that will maintain commitment. Like if you write, today I walked 10 minutes. Tomorrow I walked 12 minutes. The other day I swimmed for 20 minutes. So seeing that visualized in front of you, tracking your progress will help you maintain the commitment. Also writing down your weight if you lose weight. So progress tracking is also very encouraging. And the final advice is integrating the movement, incorporating movement in our daily life. If you have the option to walk instead of using like transportation, driving the car, if it's a short distance and now the weather is getting better, maybe you can get more encouraged to walk outdoors. Sometimes at the evening, the weather is very nice. So incorporating walking into going to the supermarket, going to the gym, going to meet someone, walking instead of using the car, and using the stairs instead of using the elevators or using the escalators makes the exercises more accessible and habitual. It becomes part of your daily habits. So my final thing is the quote from Jim Rohn. Jim Rohn is a motivational writer. I like this quote a lot. He says, "Take care of your body. It's the only place you have to live in. The better you treat your body, the better your body will give you back." That's it, I'm done. I hope I gave you some good advice. And if anybody has any questions.
That was music to my ears. Dr. Shadan, that was absolutely, it was music to my ears. Honestly, the
Thank you,
things that
Professor.
you said was, you know, I, uh, I noticed that you spoke about the complex of exercises and you spoke about the different types of exercises. You spoke about, in layman's language, stamina or aerobics, and you spoke about resistance and strength, flexibility and balance. And then the icing on the cake, you said, if you want to look at the best exercise, it is a mix of all. It is a balance. And that reminds me so much of another topic and another speaker who, when talking about nutrition, said, well, there is protein and there is carbohydrate and there is fiber and there is fat and all of that, but the best diet is a balanced diet. And here you are, Doc, saying that the best exercise is a balanced diet, a balanced exercise, which has components of everything. You know, that is simple, profound, but when a double MD tells you this, then it is gospel. I thank you so much for simplifying that. Thank you so much. You know, the other interesting, we learn so much, those of us who are fortunate to be managing these webinars, we learn so much from these webinars. And the other slide which I loved, of course, I loved it simply because I passed all the tests, but I loved it for sure, was the less common ailments in diabetes. And simply put, you spoke about the stiff hand syndrome, and then you spoke about frozen shoulder, and then you spoke about trigger finger, and then you spoke about heel pain, muscle weakness, osteoporosis or bone pain. I am happy to report that in spite of being on medication for diabetes, I have none of these less common
I'm
ailments.
happy for you. I'm
Thank
so
you. Thank you. Now, Doc, I am not going to capture your time. I will, Dr. Wilco, of course, puts together a whole series of very complex questions. I have one complex question which I will ask at the end, but right now I will hand you over to Dr. Wilco. Dr. Wilco, your question, sir.
much, Professor. Thank you.
Thank you, Professor Kennedy. First of all, thank you, Dr. Shadan. It was really wonderful session. You made me remind my certification days for with American College of Exercise. The similar way of things were being taught. And regularly when we are having webinars, so we have different exercise specialists and other things. So this is completely different aspect of presentation. Wonderful, really wonderful. And it was like Professor said, in every webinar we learn something, which I forgot. Somehow I forgot for 7 8 years back. I was doing that. Now again you refurbish everything, and now I am recalling everything what we studied. Thank you very much for that.
Thank you, Doctor.
Okay, so we'll be taking few questions. First question is coming from Jinsey Anthony. Her husband is diabetic and has sciatica. What exercise he should follow, and is it safe to do exercise? We have already mentioned many complex musculoskeletal disorders during diabetes. Sciatica is one of them. So please advise for that.
Okay, thank you so much, Dr. Wilco. Unfortunately, sciatica must be examined first by a physician because it has multiple causes. Yani one of them is the lumbar disc prolapse, and this is a serious condition. So not all exercises are allowed in lumbar disc disease, as it might lead, unfortunately, to its progression. Some exercises are allowed in back flexion and some are allowed in back extension. So it should be first addressed by a physician to correctly know the position of the compression of the disc if the cause is the disc. It can also be due to a piriformis muscle, which is a muscle in the hip region that compresses the nerve. So hopefully he can seek medical advice first, but of course this doesn't limit him from doing some exercises, at least stretching exercises, range of motion exercises, exercising the upper body. If the walking now is painful or hard on him, he can postpone it until he correctly addresses the situation of the sciatica. But properly diagnosis or knowing the main cause of the compression on the sciatic nerve will be helpful before advice with certain types of exercises in this case.
Yeah, that's a good suggestion. Anant Bhujwal has asked, we know regular exercise good for health, and you have mentioned many components and type of exercise we should be doing. There are many recommendations on social media for best results. Nowadays, reels and stories are coming in every second, claiming for best results for many health ailments. What is the most important? Cardio exercise, weight training exercise, or gym exercise for best result? You have already said mixture of everything.
I already said a mixture of everything, but some researchers emphasize on the role of the aerobic exercises to be the most beneficial type of exercises for the cardiovascular health, for the general health of the body, like walking, like swimming, like cycling. These are the mostly recommended exercises, low intensity exercises for diabetic individuals. They are the most easily practiced and available, and most probably give the best effect in diabetic patients if they cannot practice the other things like stability, like the balance, like the stretching exercises should be also doable. It's very accessible. You can do it at home. Daily stretching is not an issue. It's not difficult exercise. But if you're going to choose one type of exercise, I would go with the aerobic exercises. It has been proven that it has the best beneficial effect for diabetic individuals, especially in the cardiovascular protection.
Great, that was a good suggestion. Even we can think of doing aerobics and having a dance moment for it. Okay. Sarfraj is asking, he's pre-diabetic, and it is said morning exercise is good. Even you mentioned time and how to do the exercise. I work in a company and have hectic routine. What is the best time to do exercise? This is very common situation for most of us.
The best time to do exercise is the time available that you have. You cannot cut down the work and do the exercise. You have to properly manage your day. So you have to work in the morning. Exercising in the morning is very good. But in the morning, the weather is hot also, so outdoors the exercise is not very applicable. If you mean exercising indoors, there is no specific any benefit of having the exercise in the morning and the afternoon. The most important thing is to be adherent to a program, adherent to exercising at least, as we said, 5 times a day. So the best time is the available time that you have according to your schedule. during the day, if you can take breaks and stretch, maybe some 5-10 minute stretch during the day, and then leave the other part of going to the gym or walking or swimming at the end of the day, that will also be very good, very helpful.
Yeah, that's a good suggestion. Even you mentioned about using staircases and other things. That will be part of the exercise you should be doing
Yes, of
in
course.
your office works, office timing, moving around, stretching around, using staircases. That's a good idea, actually. And anything additional to that, that will be icing on the cake. And next question we will be taking. Mr. Mehra is asking, this is very common question. During gym exercise, trainers recommend supplements. What is your suggestion? Is supplement good or bad, or it should be taken under advice? It's a very common thing in
Very
everywhere, world around the world. Trainers used to promote their supplements.
Protein supplements are fine, but they should be taken with care and under medical advice. Anyhow, if you are a diabetic individual, you cannot put anything inside your body before consulting your doctor. He will be the most aware person of your case and what will might be harmful for you. Safety always comes first. If the risks versus benefits, always staying away from the risks before looking at the benefits. So in general, protein supplements are not bad, but vitamins, of course, are good. Anyway, you have to consult your doctor first before taking anything. And exercising without supplements will give the same kind of effect, maybe on a longer term, but adhering to it will give the result at the end.
Yeah, first medical condition has to be assessed properly, and to look after all comorbid conditions, then go for any suggestions. I think questions are almost covered, but I have one question. Like Professor is going to ask you one question, I'll be asking one question because we have seen these two complaints very frequently. We are going to corporates for health screening. So you can say 6 out of 10 people have little and bits of these complaints, like frozen shoulder and heel pain, because of their work conditions, whether they are working in a production company, manufacturing companies, or they are in the service industry sitting on computers. So for frozen shoulder and heel pain, what best exercise, home exercise they should be doing? General question.
Okay, for frozen shoulder, there are two main exercises, the stretching exercise, and I'm not sure if I can show it here in the camera. You can put your hand by the wall and start walking with your finger up to the wall and then push yourself against it. This will open your range of motion both to the side and to the front. And the other exercise is leaning forward and swinging the arm as far you can, front and back and across your body. These are the two simple exercises. There is another one exercise also using a towel. You can put a towel behind your back and say, this is my side where the shoulder is frozen. I pull the towel with the normal side and the other one, and also convert to the other side and pull to the back with your normal side. This will gradually help you increase the range of your shoulder. If it is limited up to a very high limit, I would advise that you would seek a medical advice. Incorporating these exercises together with some physiotherapy interventions and some professional stretching exercises, mobilization of the joint, and orthopedic consultation in some cases is also crucial. But if you adopt these 3 stretching exercises, like opening to the front and to the side, using the towel, and swinging exercises, these as for the shoulder. For the heel pain, we can try the toe standing exercises, like when you're standing like that, and you try to stand on your toes, and also the dorsiflexion stretching, as we saw in the slide, like when you wrap a towel, if you have an elastic band, that would be also better, and stretch as much as you can. Stretching to the back and tiptoeing. This 2 exercises stretches the plantar fascia and strengthens the calf muscle and helps alleviate the symptoms a little bit.
Yeah, thank you very much, Doc. This is really wonderful suggestion, and we'll be using your advice on your behalf, saying to the patients when we come across to the corporate health screening. From my side, thank you very much. Professor, over to you.
Doc,
Yes, Professor.
you you prescribed and mentioned often enough that moderate exercise is good. You did. And you also said that we should perhaps avoid intense exercise activity. Of course, sportsman is a different story, but people like you and me and the rest of us who are not active sports or competitive sports persons, we needn't do intense activity. Now, I'm specifically talking about this. I know, to the best of my knowledge, that intense activity increases the heart rate and may cause breathlessness and well, it may be stressful to an aged individual, etc., etc. I'm curious, you spoke about ketones, and in passing, you mentioned blood sugar. So, my question is if you could explain the ketosis angle a little bit. And my question is, are you suggesting, or is there a possibility, and this is an interesting thought, that if intense exercise increases heart rate and respiration, could it possibly increase blood sugar also? I mean, at least during the duration of the exercise. It's just a thought in my mind, only because you mentioned it. So if you can just touch upon that for a moment, I'll be so grateful.
Sure. So what commonly happens during exercise, that the muscles pick up the glucose from the blood, and the person practicing the exercise goes into a hypoglycemia. The blood glucose level lowers. This is the most common explainable thing that happens. The muscles take the glucose as fuel, so the blood sugar lowers. What will make the blood sugar higher is that some muscles that are working in strenuous activities, as you said, in vigorous activity like continuous jumping, like lifting very high weights, like doing lunges and squats continuously. These muscles don't get time to rest, and then so they don't get enough oxygen. They start producing ketones, and these ketones, the body deals with them by producing glucose, by elevating the blood sugar level. So in some strenuous activities, when the muscles cannot use the oxygen to produce the energy and start using the ketones, this leads to elevation of the blood glucose in the level, causing state of hyperglycemia. And this is one of the things that I said we must monitor in diabetic patients. If the blood sugar rises above 250 to 300, then we must stop the exercise immediately and maybe take an extra dose of insulin to adjust that. So since these strenuous or vigorous activities might have side effect, as I said, we're always weighing the benefits versus risks. We should be practiced by moderation. And if you want to work on increasing the bulk of the muscle, increasing the strength, it could be done also without putting extra load on the muscle, so the body doesn't go into a state of hyperglycemia. I hope this answers your question.
That was brilliant. I mean, Doc, I have been in this space as a competitive sports person earlier, and then subsequently as a teacher in this space, etc. And after 50 years, to learn something new is the greatest gift you can give me. Thank you so
Thank you so
Thank
much.
you so much. I mean, it is marvelous the way you presented it. I knew the other aspects of increased heart rate and respiration and things like that, but your explanation is, at any rate, I am I it is added knowledge to me. Thank you so much. Thank you so much, ma'am. Dr. Sharan, thank you so much. And I'm now going to wrap this session up by thanking you profoundly once more for that lovely talk, especially a talk that is so dear to my heart. Thank you so much. Thank you to Dr. Wilku for putting this program together, sir. Thank you so much. Our participants, I'm sure you have benefited from the profound simplicity of the way this was presented by Dr. Shadan, and I should not repeat this, but a double MD speaking with simplicity is valuable. Is valuable. I'm sure you have benefited from it as I have. And of course, all this comes to you because of the great technology that our IT department provides and the hard work that Arabian Wellness puts in. Friends, we do this every week, and this is our gift to you and a gift we receive also from our speakers. Our next subject is on Friday, the 17th October, and Dr. Shadan spoke about retinopathy. Well, here it is, diabetes and eye care. So I'll see you all again next week, and thank you so much. Good day.